Welcome to this podcast. How does sports medicine address the demands of specific athletes? In this podcast, we'll be focusing on female athletes. At the end of this podcast, you should be able to assess the degree to which iron deficiency and bone density affect participation in sport. The focus for this podcast will include eating disorders, iron deficiency, bone density, and pregnancy. Eating disorders include a variety of conditions. The first is anorexia nervosa. Anorexia nervosa includes a loss of 15% of body fat, which is accompanied by body image perceptions, for example, the feelings of being fat, control of eating, i.e. not wanting to lose control, and a preoccupation with food preparation for others. Bulimia nervosa includes binge eating during which a person feels disgust for themselves. The person attempts to compensate for this overeating by purging or vomiting, usually using laxatives, or combines a program of restricted eating with compulsive exercise. Athletes most at risk include female athletes, particularly those female athletes that have weight restrictions in particular sports, such as gymnastics, wrestling, and of course dancing. Eating disorders are serious mental illnesses. The psychological effects include difficulties with food, loneliness, fear or disapproval, and mood swings. The physical effects include kidney dysfunction, urinary tract infections, dehydration, seizures and muscle spasm, and loss of menstruation. Of course, all of these affect female athletes' performance in sport. An iron deficiency can lead to a condition called anemia. Anemia is characterized by feelings of lethargy and fatigue. Iron joins with hemoglobin and red blood cells to help carry oxygen around the body. Most oxygen is carried around the body as a substance called oxyhemoglobin. The causes of iron deficiency in young female athletes include menstruation, pregnancy, lactation, vegan diets, and diets low in iron, particularly heme iron, which is found in red meats and easily absorbed by the body, and diets low in vitamin C. Teenagers are particularly susceptible to iron deficiency, as are female athletes and older athletes, and particularly athletes that have intensive training programs. Iron is found as either heme, which is found in red meat or liver, or non-heme, which is found in green leafy vegetables, pulses, legumes, and whole grains. Non-heme sources need to be combined with a vitamin C source to increase the body's ability to absorb it. Also, eating a non-heme source of iron with a heme source of iron, for example, steak with green leafy vegetables, also improves the body's capacity to absorb that iron. Any reduction in oxygen carrying capacity leads to feelings of fatigue, which of course impacts on training time and aerobic performance. Bone density can also be linked to eating disorders and other nutritional deficiencies. Usually this comes about because of a lack of dietary calcium, leading to conditions such as osteoporosis, particularly in older women. However, bone density decreases in women who are not menstruating, those who suffer from a condition called amenorrhea, as in the case of extreme weight loss. For example, athletes who have weight restrictions, for example, judo players, weightlifters, kayakers, and other sports where body image can be an issue, such as diving, gymnastics, and beach volleyball. A decrease in bone density can lead to an increased occurrence of fractures and breaks, including stress fractures, which limit the body's ability to compete in long-distance aerobic sports such as marathon running and training on hard surfaces. Increasing calcium intake, particularly dairy products, and supplements, including vitamin D, along with weight-bearing activity, helps to increase bone density. There are many issues involving pregnancy and competitive sport. These include issues such as overheating, the impact of sports on the body, and issues related to diet and nutrition. In general, women can continue to exercise in the first and second trimester of pregnancy. However, it is recommended that only some aerobic activities are continued. To avoid overheating, precautions such as training early in the morning or late in the evening are recommended, with adequate hydration, and aerobic activities such as swimming and aquarobics are also recommended. Massage should be avoided, especially as the pregnancy progresses, and avoiding impact sports such as skiing and water skiing are important, and changing from road cycling to stationary cycling is a must in the second or third trimester. Diet is just as important and involves adequate amounts of iron-rich foods, calcium, energy-rich foods such as complex carbohydrates, which includes folate, and hydration need to be carefully monitored during all stages of pregnancy.